when we decided to go into the veterinary profession, we had this great big goal, right? Like we had this goal to go to vet school. And for many of us, this goal started way back, like when we were younger. There's a few like different studies out there, just rough studies out there that have asked veterinarians, like, when did you decide you wanted to be a vet? And many of us decided when we were little that we wanted to be a veterinarian. And so we always worked toward that. It was kind of just part of our existence, right? It's something we wanted to do. And so we did it. And so because we had this goal for a really, really long time, as we continued to work toward it, so when we went to college and we did all the prereqs and had to take organic chemistry or any other chemistry and any other stuff, the harder classes for you, it's a little different for all of us, right? But as we came across those challenges, we kind of expected them. Like we knew when we wanted to go to veterinary school that it wasn't going to be a really easy goal to achieve, but we also believed that we could do it. And so as the challenges came toward us, we anticipated them, and we also just figured it out, right? We just figured out what we needed to do to overcome the challenge so that we could keep going. And the reason that we kept going was because that goal, that thing that we wanted, which was to graduate from veterinary school or veterinary technician school, that thing that we wanted was bigger than the challenges in front of us. We didn't have any framework to believe that we couldn't get there. We kind of anticipated the challenges and we just kept moving forward. Now, we were able to do that because we could visualize the end result. We would think about what it would be like to be a veterinarian, and we would dream about that. We would even, and then as we got into veterinary school or veterinary technician school, we would think about what it would feel like to walk across the stage to get that diploma and to have those credentials tagged on to the end of our name. And so for years, we lived in this excited anticipation of reaching that goal. So just think about those times, think about those days. Now, I'm not saying that there weren't some days when your studies were really challenging or that you were afraid you weren't going to pass an exam or something like that. But aside from those moments, which were not the constant, was this underlying excited anticipation that kept you moving forward because you could visualize what your life was going to be like when you walked across that stage, you got that diploma, you got those credentials on the end of your name. That was the goal. That was the dream, right? Like you just kept moving forward because you could visualize that. And then during that period of time, you actually made a lot of plans and took a lot of actions from that place. So examples of that is as that goal got closer, you started looking for jobs, you started preparing to move, and you also probably started to buy a few things like the name tag with doctor or DVM on it or CVT, RVT, LVT, whatever it is. You started to take actions in anticipation of meeting that goal. And that was all really fun times, right? As you look at all the different job opportunities, the different places you could live, the different jobs you could do, you start getting some of the gear, you buy your stethoscope, you buy this maybe a customized cover for it, a name tag, a stethoscope tag, all the things, the boots, the coveralls with your name on them. Like we do all of these things at that point, and a lot of it happens before we've actually reached the goal because we just know we're going to get there, right? Even before you were like into the professional program, you still made decisions and took actions because you believed you were going to get there. Like it wasn't an option that you wouldn't. And so what's interesting is that as all that happens and we keep working toward our goal and the goal gets closer and closer and closer, that excitement builds for sure. And then this really interesting thing happens when we graduate. So graduation day is like the pinnacle. Like you're walking across the stage, you're getting the diploma, you're being hooded, like you're now the doctor or the technician. There's celebrations. And then within a few hours or even the next day, when it all just settles down a little bit, a lot of us kind of feel this, And it's not like a big sigh of relief. It's more of just a recognition that something is different, that we feel a little bit different. And what it is that it's that excitement, it's that anticipation has started to drift away a little bit. Now, in this period of time, we have those new jobs coming. we're looking forward to that or getting ready to start. And so there's some excitement with that. And there's also like this nervous anticipation because it's like all a new thing. And so there's a little bit of uncertainty there. And if you're going into like an internship or residency, like additional education, you have that same kind of thing. You're excited about this next phase of your journey, but you got a little bit of the nerves too. And that's all very normal, very healthy. And so you keep moving forward from that place. But what was like full on excitement has now kind of been added with a little bit of nervous excitement and a little bit of like fear almost. This anticipation, fear, jitters, whatever you want to call it. And as we step into that, we keep moving forward from that place. So even though it's a little scary to start that new job or that new internship, we still do it, right? Because we're still excited about what we're doing. Right? We're doing the vet thing, and we're now stepping into the next phase of whatever the vet thing looks like for us. And then as we get in there, usually it takes a couple of weeks, and then that nervous anxiety, that nervous excitement, if you will, that has been driving us, it starts to go away because the nerves go away. So you're no longer jittery and nervous going into work every day. So that part is gone, but you're also probably no longer as excited as you were to go into work every day because you started to understand what the routine looks like. And what makes this a little bit worse is that after a few weeks in practice, you also start to feel a little bit anxious and you start to worry a little bit because now you're doing the job, and what was all this excited anticipation of the job has been replaced by like anxiety and worry about how you're doing the job. So you find yourself worrying about your patients and worrying about client interactions. And I'm not saying it's worry all the time, but what it is all of a sudden, if you pay attention, you're starting to carry around like this anxiety. And for many of us, it's just like this low level anxiety that's kind of always there. And then it definitely spikes too when things kind of go awry, when you have a challenging case that you haven't seen before, or you're doing a tough surgery, or you're having a difficult conversation with a client. Like that can definitely spike the anxiety, and then it comes back down. But then what tends to happen is it just kind of hangs out there, this low level anxiety that's always there associated with the jobs that we've chosen. Now, I'm not saying that it has to be that way, but I'm just saying that that's often the case for many of us. And so what happens is that from that place, there's a bit of a downward spiral that starts to take effect. And many of us don't notice it at all when it starts.